Okay guys, we're going to go through and look at what it takes to help establish an IV, to help that paramedic be able to do those paramedic or ALS level skills that he needs to do if it's a serious or critical patient. So this video is going to be a little less coordinated. I'm going to do a lot of skill shows, so I'm going to be moving the camera around a lot. So hopefully you can kind of get a feel for how this is. So it's really important for you to know right now that you're probably not going to encounter this type of questioning on the written exam for National Registry, but you still need to know this in order to be a competent provider in the back of the ambulance to help assist our paramedics on these calls. And it's probably one of the biggest complaints that I have from our ALS providers is that we're sending the students out. They're ready to be EMTs, but they're not necessarily ready to help assist a paramedic when the paramedic needs that extra set of hands. So I'm going to go through these skills and kind of help show you what it is, and then hopefully during your ride time during the field internship, you'll be able to kind of practice these skills and get the hang of them. So we're going to go ahead and try this and see if we can get through it. So whenever you have, I'm going to click to the next slide here. Now, you can kind of get a full picture view. Whenever you have a patient who requires IV access, there's some important things to remember. First and foremost, you'll probably find a kit like this somewhere in the back of the ambulance, or maybe it may come in pieces and parts. So we're going to take a look at each piece. First and foremost is the tourniquet. So this is our venous constricting band, or our tourniquet that your paramedic will need in order to do the skills. So there's that. The other things that come in this pack include your alcohol preps. Kind of get those up there where you can see them. I don't know how good the visual is, but there's that. You may have to have, if they don't get their IV access, or if they have to stop or whatever, they may need a 2x2, so that's very common to have. And then you'll also have this, it's called a Tegaderm, and I'll show what this looks like in the package here in a few minutes. And then the other thing that you might have is referred to as an extension set. And you'll see the title extension set in the top corner of the piece of equipment. And the other thing too with these plastic bags is you will actually find a tear point on each of these plastic bags. I've seen people, myself included when I first started, battle with these bags that the equipment comes in, and it seems like it takes more Herculean strength to get through these than anything else. So if you know where that tear point is, it makes it easier to peel and pull this equipment out. Now I will tell you that if you're helping the paramedic at this stage, you want to try to keep this in the bag for as long as possible, unless he has a personal preference or she has a personal preference on how she likes for things to be done. So this is our extension set. And probably one of the first things you'll do, I'm going to turn it over because you'll see it inside the bag, is you're going to grab the end that's blue. And as long as you don't drop this in the floor, you're good to go. If you drop it in the floor, then we have problems. You'll have to start over and get a clean one. A lot of times what they'll tell you in the back of the truck is take an alcohol prep and clean off the entry point. So you can do that very simply. I'll go ahead and show you. So you pull that alcohol prep from your bag or from your little package, and you just wipe that clean. Okay. Then over here, you're going to find a syringe in a plastic bag, and it's going to have fluid in it. And that is called a saline flush. You open the package, remove the cap, a little twisting motion, and you're going to see that this is like a lure lock. It locks in, so you're going to have to take those two, twist, push in and twist as you go. Then, and I'm going to go ahead and take this out of the bag so you can have a better visual. And I'm going to try to protect my keyboard so I don't make a mess. what you'll see is that as you advance the fluid, and this is what you want to do, you want to advance the fluid and you'll start seeing it. There's a little air bubble right there. You can see me kind of manipulating that air bubble. So you want to push the fluid till it comes out the end, and then you've got this full line. You can go ahead and you can push this. That's your little crimper device, and that'll keep it from losing any fluid. As I mentioned before, this is going to stay in this bag, so hopefully you still have it sitting in there, but I wanted to make sure that you could at least see it clearly and know what you're doing. So this would still be like this as you're doing the push. So now you have this, you can set this off to the side. That paramedic is ready for that extension set. And I'm going to try to wipe my desk off here a little bit so that I don't keep making a bigger mess. The other thing the medic will need, unless he just wants to use a saline lock with that patient, he's probably going to hang a bag of fluid. So I'm going to show you how that works. The other thing that I do want to talk about, though, before we get that far, well, I'll go ahead and do this. It'll be okay. So this is a bag of normal saline. You'll see it at the top. It's written across here, normal saline, your sodium chloride. And you want to check for your 5 rights. You will learn that when you get to the pharmacology chapter of your class. But just so you want to be clear, you want to look at the bag of fluid. You want to make sure that it's not expired. So when you look at these, you'll see the expiration date typically in the top. There's your expiration date. And you want to make sure you look at the bag and it should be clear. There should be no floaties or particulates or anything crystallized inside this bag. If that happens, chuck it, get a new one. So this is what that bag of saline looks like. And at the bottom, you'll see that you've got 2 chambers. One looks like a medication cap, it's blue. And then the other one has like a little pull tab. So what you're going to do, and understand that this is, I'm going to kind of take a step back here because I'm trying to show this as we go. You're going to end up popping this cap, but we're not going to do that quite yet. I want to show you the other piece of equipment that you have. In the video for this chapter, we talked about a micro drip, micro meaning small, and a macro drip. The macro drip infusion is large. So if you look at the drop sets, it's going to look like this or something similar to this. It'll have IV administration set across the top, and you're going to see a big fat 10 here. That means that this is a 10 drop set. It is 10 drops to equal 1 milliliter of fluid, or 1 cc of fluid if you prefer. And so it takes 10 drops. This is your macro drip. It is a large drip, and I'm going to show you the difference here in a second. The other one that you may see is this one. Again, you'll see IV administration set across the top, but you're going to see 60. 60 is your micro drip set. So this has got the smaller needle. It's still 60 drops to equal 1 milliliter of fluid. You're ending up with the same amount of fluid in either this one or this one. Whoops, helps if I hold it up right. But this one takes less drops to get to 1 cc. This one is more particular. So this is more common in general patient care and trauma patients. The way to remember this is you want to get as much fluid to the trauma patient as quickly as you can, because you do not want that patient to have low blood volume or hypovolemia. So 10 drops gets in the system quicker. The 60 drop set is different. The 60 drop set is meant for your medical patients that require medication to be given over a very precise period of time. Think about this. There are 60 seconds in 1 minute. If I need to give a medication very precisely, which one do you think is better? The 10 drop or the 60? This one's going to be more accurate. So this is for your medical patients that require medications. This is for general patient care and trauma. So I'm going to go ahead and I'm going to open both of these and I'm going to show you what they look like so you can kind of get a better feel for it. So again, like mentioned before, there is a little tear point. There is a tear point right here. These are the worst because it seems like when you're in a hurry and the patient is really sick and you have to open this bag and pull this apart, it will knot itself up when you need it to be out the most. So this is the one, and I'm going to set this down. Remember, in the back of an ambulance, you wouldn't be able to set this down freely. You're going to have to kind of keep it sterile or as close to sterile as possible in the back of a moving ambulance. So let me open the 60 drop because I want you to be able to see what they look like. This is another case where you're trying to find that little tear point. All right. So what you're looking at here, this, and I'm going to go ahead and take this off. In real life, you would not do this yet, okay? And you never, never, never touch this. Never. Because what I just did is put germs on this, and it's going to go into your bag of fluid. So that means that you're giving germs directly to the bloodstream of your patient. So never touch the spike. This object here is referred to as the spike. So a lot of times you'll hear your medic say, go ahead and spike me a bag. They're asking you to pull this drip set out, pop the cap, and connect it to this. That's spiking the bag. But that's what that spike looks like. This is known as your drip chamber. This big white thing inside is how you know this is a 10 drop set and not a 60 drop set. Let me give you a comparison. This is the 60 drop set, and I don't know how to show you this. Maybe let's try. Yeah, if you look inside, you'll see just a little teeny tiny gray needle in there. That little teeny tiny gray needle, that is your 60 drop. So it's a very big difference from this to this. You can't confuse them, okay? So I'm going to go ahead and I'm going to set this 60 drop down because it takes a little bit longer to run the fluid through. So if your medic tells you to go ahead and spike the bag, again, you want to maintain as much sterility as humanly possible. So you're going to keep this bag up. You're going to keep your drop set up. You're going to go ahead and pull this cap. Remember we talked about this? You're going to pop that off. And then you're going to spike your bag. In real life versus textbook, textbook will tell you never, never, never grab anything by the mouth. I will tell you in the field, a lot of times people just pop it loose with their teeth. But in textbook world, you want to pull the cap off. Now, this is where you're going to spike your bag. So keeping it just like this, don't turn your bag over. You're going to, it takes a little bit of pushing to get it in there. The next thing you want to do before you ever turn this bag over, take this roller clamp, see the roller clamp? And you're going to roll that clamp down. That way, when you turn this over, nothing's going to happen. Nothing will happen until you squeeze the drop chamber. When you squeeze the drop chamber, you only want to fill it to about the halfway point. This is perfectly fine. This is perfectly acceptable the way I have it. What you don't want to do is fill it up all the way, because then you can't monitor what you're doing and it's harder to work. So I'm going to flip this back over just temporarily so you can see what I'm doing. Okay, now we're back to ground zero. So we've now officially spiked this bag, but we're not done. Okay, what has to happen next is you have to get the air out of this line, because the only thing that has fluid in it right now is this drip chamber. So in order to do that, and this is where life gets complicated. I'm going to set this down. You tear that piece loose that was holding it all as a unit, and now you're going to have this free-flowing tube. A lot of times what you'll do, and most of the time by now, we've already got this bag hung up and we're hanging it in the back of the truck on one of the little clips. So this is hanging up in the air. So we're just going to pretend right now that this is hanging up in the air. And what you're going to do is you want to keep this end sterile. You're going to do everything you can to keep it sterile. And here's the little tip. If you get sidetracked and you have to do something else, you can always use the back of that roller clamp. It's got this little thing here, and you can actually place that into the roller clamp. Let me see if I can do this. I'm kind of in an awkward situation here. So if you get busy, you can always hang it up there. So in the back of the truck, it would look like this. Bag is hanging. There it is. It's ready to go. But you need to get fluid through this line. Now, why is this so important? With air in this tube, there's enough air in this tube to kill a patient. Let me repeat this again because it's very important. There is enough air in this tube to kill your patient. You must clear the line. So spiking the bag, prepping the drip chamber is not enough. You have to drain this line of air. How are you going to do that? Your bag is hanging up. Your bag is hanging up. You're going to take this roller clamp and you're going to open it up. And when I do, you're going to see that you're going to get this run of fluid into the drip chamber. And you'll also probably see the air start going down. See, there it went. And you can see it dripping. Now we've got this full line and we're allowing this to drain onto my table. But that's what that looks like. When you get the line where you want it to be, once all the air is out of that line, you're going to head and close that clamp off again. Okay, now we're ready to go. You have officially spiked the bag for your paramedic partner. Just like we did with the extension set, we want this line to be completely clear with no air in it. We have managed to do that. All right. If you needed to and your paramedic wasn't ready, you can actually just put this on the back side of that roller clamp. It'll be hanging up in the truck. He can do an easy reach, grab, and pull, and it's right there when he needs it, okay? So you have officially done an ALS Assist skill when you have this ready to go. And remember, it's all about maintaining sterility when you spike the bag and also making sure that this doesn't drop in the floor. Do the best you can. Now, the other thing the medic may ask you to do if he's starting an IV is ask you to grab him a IV catheter. IV caths come in different sizes and different gauges. Here's the rule of thumb. If it's a 14 gauge and you're comparing it against a 24 gauge, the 14 gauge is bigger, the 24 is smaller. So when you look at these two needles, you can see the needle here. Look at the diameter of these guys. This one is actually smaller. You can make it out. This one's the larger of the two. Now, the nice thing about the IV catheters is they are color-coded according to size. So if they tell you to get a 14 gauge, you're going to most likely pull an orange, and you'll see even the catheter has an orange cap inside it. Orange package. And you can read it on the package. I don't know if you can actually see it in this video very well, but if you look up here, you would actually see, yeah, it's kind of hard to read, but that actually says 14 gauge. If you didn't need a 14 gauge, and these you're going to see in your trauma patients, they need fluid fast, because remember, we want to keep them from being hypovolemic. We don't want them to have low blood volume. So this 14 gauge is a larger needle. it's going to drop that fluid to them faster. On your normal patients, your average everyday Joe Schmo who just needs medical assistance, they're going to start an IV probably with an 18 gauge or a 20 gauge. 18 gauges are green, 20 gauges are pink. Just like before, you'll see that inside that catheter is pink here. Inside, this one's green. And I'm going to take them out of the package so you can see it. But again, you'll see it written on here. It'll say 18 gauge. So I'm going to go ahead and open this one. Although maybe I'm going to open the 14 gauge because it's bigger and you can probably see it a little bit clearer. So when your partner needs this, you're going to find that opening. You're going to peel it open. And if you do it right and you peel it like this, again, this is something you don't want laying around. You want to keep it in the sterile package for as long as possible. But your partner would just be able to reach over and pluck this when they're ready. So when they're ready to pluck this, they're going to pull it out. And these are all just a little bit different, but they all operate the same way. You're going to see this very large, scary needle with the orange. That's how we know this is a 14. And it has a plastic catheter around it. So I'm going to do what we're not ever supposed to do, and that's touch this part of the catheter. You guys will not be responsible for doing anything except probably opening the package and laying it out so your partner can just grab and pluck, okay? That should be all you have to do. But I'm going to do something that we're not supposed to do because I want you to see the features on this needle. So I'm going to go ahead and pop the cap on this. If you have to open a cap for any reason, make sure you grab it with both hands and kind of wiggle it loose because it does get snug on there. The last thing you want to do is this, because if it breaks free, you could stab yourself. So I'm going to come down here where I have a little bit more control. There we go. Okay. So this is your needle, and you'll see a flashback chamber. So when they get into the bloodstream, this will fill with blood back here. You'll see it turn red. That lets them know they're where they're supposed to be. The other thing about this, and I'm going to go ahead and take this plastic catheter off. I'm removing the needle. So this is what's going to be left in the patient's skin. It's almost like a plastic straw. And on the back side of this is where the end of that, oh, my cap came off. The back end is what's going to connect here. So on that drip set, this is what you would have. Okay, and they'll connect it on. Now, if they choose to use an extension set, this is where it changes a little bit. Not much. They're going to grab this from the plastic bag that you left it in. They're going to remove the cap, and they're going to connect it. And they may draw back to make sure that they've got blood coming in. And remember, we've got this pinched off form. They may draw back. You can see the air kind of flowing through because we don't have it connected to a vein. And then grab tissue. They'll go ahead and they'll inject it. And they'll just make sure that everything is good with the line. You'll see them squish it out here, and here it comes out. And then once they're done, remember, this is now in the patient. So they're going to uncap this, and then they'll grab their extension set, their drop set, or their administration set. Goes by 1,000 different names, and they'll do exactly what you did before. They're going to push this in, and as they push it in, they're going to screw it together. So now we've just created an extension to the administration set. Okay. Now we have this in the patient. Hopefully your partner has done this so that you don't have to worry about it, but this needs to go in the sharps container because we don't want to accidentally stick ourselves with someone else's blood. So it should look like this. These are safety caps, and they're meant to protect us from accidental sticks, but we don't trust them. We still want to put it in the sharps container. So this should be gone and in the sharps container. Then we have to be able to get this, which is sticking out of our patient, taped down to the skin. And that's where this Tegaderm is going to come into play. So you may be asked to help because it's very difficult to try to do this with just 2 hands. Doable, but a lot better if you have help. So let me tell you, go ahead and get my Tegaderm ready. You'll peel it out of the package, and this is what you have. It's literally nothing more than what looks like a Band-Aid, but it's clear, okay? And when you peel this, it's going to peel. Oh, and you don't want it to do that because it'll stick to itself, and then it's not cool anymore. We're creating problems here. And then you're going to peel this, and it'll go on either side of that vein. So what you would hopefully see, gosh, in reality, it's going to stick like this, and it'll be stuck to the patient. So we'll stick it to myself so you can kind of see. It should look like this, except this would be in my skin. And then you would peel the cover off. Not my best attempt at showing this in the world, but you know, that's what it looks like. Ow, I just took my hair off. Okay, so that is how you help your paramedic get his IVs established. So remember, you're not really going to be doing the actual sticking skill. You're just prepping all of this equipment to make it easier on him as he's doing it. I hope this part has helped. I'm going to stop the video now, and I'm going to do a separate video on the intubation skills or airway management. One other thing before I go is I do want to show you. Now, I don't have the drill with me, but we did talk about intraosseous. Intra meaning within, osseous having to do with the bone. So that's where we're actually drilling into the bone to get that venous access. Anything you can put in an IV, you can give through the bone. So anything that you would hook up this drip chamber, or excuse me, this drop set to the bag, can go into a bone. This one is made specifically for pediatric patients. Adults, our bones are harder, and that requires us to use a drill. And it really does. It is a drill. Looks like a drill. And it has a needle similar to this on the end of it that gets drilled into the bone. This is for pediatric patients. So I'm going to go ahead and open this bag so you can see what this looks like. If you have to get the drill, just know it's usually in a yellow, let me repeat, a yellow bag. And the yellow bag is probably about this big, maybe about not quite a foot in width. And it's got a little drill in there, a little burgundy colored drill, and it will have the needles to go onto it. Your medic will know how to do that part. All you're probably going to do for that interosseous is pull the drill so that they can have it at their disposal. So I've got some background noise here, so I apologize. They're coming out of a meeting. This is what an interosseous cannula looks like. So you can see how this appears. This is what would go into the pediatric patient. This is a hand boring auger, so they would actually be drilling this into the bone, and that's for pediatric patients only. The adults are done by the drill. So I'm going to go ahead and put this back together and set this to the side. That is your interosseous. I just kind of wanted to give you a visual to that. When they do have to put these in your patient, just like with everything else, there's a stylet that will come out. This goes in the sharps. This is what's in your patient. Okay. When you use this, they're going to either have that extension set or the administration set connected directly to this, and it does just like the other did. It's a lure lock adapter, so it just twists on and holds it to the bag. But here's the thing with this bag of fluid. Because we are putting fluid into a bone, and the bone is a solid structure, it takes pressure on this bag. So usually there'll be a pressure bag, or if you don't have a pressure bag, you could take a blood pressure cuff and squeeze the blood pressure cuff up, pump it up around this bag, and that'll give it some pressure to help push the fluid through. If that patient is alert at any chance at all the patient is alert, they're going to feel it. This is going to hurt. So your medic should probably give them a medication, lidocaine, to help numb it so that it's not as painful if they have any type of alertness to them at all. So again, the only thing that you're probably going to have to do is pull this equipment out for them. They'll take care of the rest. If you're helping them, make sure that you put a pressure bag on this. So you want to use either a blood pressure cuff or the actual pressure bag, which looks like a BP cuff. Squeeze it up, pump it up, so that it gives a little pressure to force the fluid in. That's it for this. The next video, you'll get to see how to manage the airway. Thanks.